everyone, and welcome to the Curriculum Community of Practice. A few people are still joining, but we have two great presentations today about safe sleep. One by Devin George from Cribs for Kids, and one by Moira Hankey from Charlie's Kids. So I'd like to just introduce everyone to them while people are still sort of trickling into the meeting. This meeting is going to be recorded, so I'll be sending the link out to all staff after a few days after the meeting, where it'll be posted to the website. The recording will be posted to the website. Devin and Maura, who would like to go first? Thank you very much for joining us today. This is really great. We have a lot of staff here, you can see, so it's a big audience.
I don't know that we have time to rock, paper, scissors.
Okay, why don't you go first, Devin, and then we'll have Maura.
Okay. All right, great. Sorry, Maura, if you were like, I think it probably makes more sense too, actually, if we go in this order. Hi, everybody. Thank you so much for including Cribs for Kids in this. We absolutely are so happy for this opportunity. I want to introduce my colleague, Spencer Poston, who is on board this call and we'll be putting some things in the chat. Let me see if we can start the slideshow here and see what you see. All right, you guys see it? Oh, I have to share my screen, I imagine, don't I? Do you have the ability to do that for me, or do I need to?
You should be able to share your screen. I made you a co-host.
Okay. I want to be sure that you see what. Okay. So I've had issues before. Maybe we should have.
I see a blue screen. Oh, there we go. Now I see that, but I can see your notes too.
Oh.
Maybe your other screen do you have another screen that has the
Yeah, I'm sure Spencer is like, oh my gosh, Devin.
Yeah, Devin, do you have two screens up right now?
Yeah, but what happens? I've had this happen before on this where it doesn't. What do you see?
Oh, there it is.
You're good. Yeah.
That's
got
perfect.
it.
Yeah.
Okay. So, but I need to, my issue is now I can't see it and drag it. Let's see. Okay, it'll be fine. You know what? I can't see to move it forward now. But we'll just kind of go through it. All right. I'll just click best as I can. Seymour, aren't you glad? Aren't you glad? Yeah. All right. Hi, everybody. I remain Devin George from Cribs for Kids. And Spencer, who you heard already. So in the next 30 minutes or so, I'm going to go over the current landscape of infant safe sleep, let's make sure you all know in New York State what we have going on with Cribs for Kids, and talk about some free resources and tools that we have to offer. And really, there's a lot of them. And that's what we want to be sure. And that's what the focus is on this topic. So quickly, Cribs for Kids. We were founded in 1998. I am coming to you from this building that you see here that we're flying through into our warehouse. We are a national nonprofit. We're an infant safe sleep initiative working to reduce infant mortality by preventing those sleep-related deaths from suffocation in SIDS. We operate through a network of 2,000 partners across the country. Our partners you see here are health departments, hospitals, social service agencies, government agencies, public service departments, nonprofits, and more. Since our founding, we've provided and distributed over 1 million safe sleep spaces across the country. And what is unique about us, and when we talk about partners, we are national. We provide resources and tools to those of you who are doing all the hard work in the field, in the community, with your families. And we fund all of these free resources by the manufacture and purchase of our safe sleep products. So what you will see, and possibly you've seen them in homes you've been in, our foundational product is our cribette. And we have a mini cribette as well. And it's so selling all of our infant products to partners then allows us to fund and create these resources. And that is the brilliant design of our CEO and founder, Judy Bannon. Cribs for Kids is built on 4 pillars. We're going to talk about education and programs the most. I just gave you a bit about products. I think, let's see if we're going to go ahead and put this, I think, in the chat. I can't see the chat, so Spencer is putting a link to our product catalog. There's a real breadth of infant products there. So if you're working with somebody who's heading down to Target to buy a cribette, or a pack and play, we ask you to consider Cribs for Kids, because then you're funding all the things we're going to talk about. And also research. We do work with, for example, our Children's Hospital here in Pittsburgh. We're doing a research project with Boston Children's Hospital, supporting them in finding participants in their research. But our big thing that we are doing this year, and Spencer's going to put a link to that in chat, is September 29th to October 2nd is our 9th National Infant Safe Sleep Conference, Cribs for Kids. Come here to Pittsburgh, which National Geographic said is one of the 25 cities to visit across the world in 2026. So put that on your list. We'll share more about that. So let me give you a quick reason why we're here. So when we talk about SUID, that's the umbrella term, sudden unexpected infant death. And the three categories that fall in here are accidental suffocation and strangulation in bed. Those 100% preventable. And all the work we do is to prevent those deaths. And then SIDS that everybody is afraid of, right? It's so scary to hear, but anything we do to prevent suffocation is also going to reduce the risk of SIDS. And then unknown. That's when an ME or coroner goes in and looks at everything, and there's really an undetermined cause for infants passing, but very often unsafe sleep factors are present. So you will see, any of you that sit in on a child death review or on your femur may see unknown or SIDS with an unsafe sleep factor, because that is a dreadful message to deliver to a family who is loving and caring for their baby. Nationwide, we're not doing great. Before the Back to Sleep campaign, we would lose 10,000 infants a year. The simple act of putting baby to sleep on their back has reduced this to about 3,400 a year. However, we've seen a rise up to 3,700 SUID cases. So we're going in the wrong direction. Another reason that we're all here. And you can see, look at your pretty light state up there. Good job, you guys. Right? You have one of the lowest rates of SUID in the country. Pennsylvania is one shade darker, so we're aiming to where you get to. But congratulations on your good work. What we're learning about SUID now and the change in when I mentioned the rise, Dr. Wolf and her colleagues did a review of all of the SUIDs that were reported in 1999 to 2002, and they found great news. Infant deaths have decreased by 24% over the past 2 decades, but simultaneously, these SUID cases, the suffocation, SIDS, and unknown, have increased by 12%. What does that tell us? It tells us that we're getting a lot better at dealing with those high acuity infants, but it tells us that we're doing worse when it comes to sleep-related deaths. The authors of this report posited that it could be 3 things. They looked at COVID-19, right? Those who were already resource strapped found themselves really with fewer resources, putting them in much more tenuous positions. You know, couch surfing, Sharon puts them in a place of sharing sleep surfaces. So that really was a drag down on the people who were already at risk and vulnerable. And then also discussing that safe sleep behavior, is that mimicking vaccine behavior, right? That lack of trust in healthcare professionals and experts, and nobody's going to tell me how to care for my baby. I don't care if you tell me that it's unsafe to bed share with them. That's what I'm going to do. So does that attitude transfer over to safe sleep behavior? And the impact of social media. You can, social media is great for some things and really horrible for other things. We know that when you want to find your tribe of people who believe what you believe, that's a great place to go. Spencer's going to put a link in the chat, maybe she has already, to Lauren Kirshner's fabulous article that she did for Consumer Reports that discusses that. I encourage everybody to read that. Lauren reached out to some people to do kind of a basic infant safe sleep article in October last year, which is Infant Safe Sleep Month. And when she spoke to some people, she realized that this was a much bigger article worthy of attention, and Consumer Reports gave her that space. And she talked to so many people and did such a fabulous job. We just love that article that she did. So I hope that you're able to link and take some time to look at that. Here's what we want to talk about. Here's why we're here. Sudden unexpected death involving unsafe sleep is the #1 reason we lose our babies once they leave the hospital. We lose more children. This is a gaspable statistic. We lose more children in their first year of life to an unsafe sleep or sleep-related death than all of the children that we lose up to the age of 18 to a motor vehicle accident. It's unbelievable, but we don't hear about it. So this graph that you're looking at, that first bar is for our children that are 0 to 1 year old. The other bars go to age 17 and 18. So gunshot wounds, abuse and neglect, motor vehicle accidents. We lose far more to those. And it occurs in the first 4 months of life. No real magic to try and understand that, right? What is mom doing at about the first couple months, 4 months, going back to work, exhausted. So, but despite these numbers, we know that these cases are underreported in the media. You don't hear about these babies dying. And so that means people don't think it's happening. So they don't change their behavior. Nurses, doctors, social workers, home visitors don't know that it's happening. So they don't change their practice when they're going in and talking with families. So here we sit, 3,700 babies, 10 babies a day. We're talking about death here. We don't even talk about all of those infants that present in the emergency room with skull fractures, clavicle fractures, traumatic brain injuries. Those all happen. Generally, those infants are older because they can move and get themselves out of an unsafe situation, but then wind up with an injury. Our other challenge that we're facing is in loss of federal support, right? Our federal government shuttered the NICHD Safe to Sleep campaign, stopped 3,800 research grants, pulled back on CPSC commissioners and staff, which relates to product safety, right? And the AAP Safe Sleep Task Force, that was shut down, we believe, in response to the AAP's answer to the HHS's vaccine schedule. They filed a suit. They've got that back. That is back in business as of right now, assuming there is no appeal to that. But there is a silver lining, perhaps, with our federal government having no unified message about infant safe sleep and preventing suffocation and SIDS. We do see organizations like ours and Charlie's Kids working to amplify that message. And also we see states really stepping up to fill that gap. New York, you are doing an unbelievable job. Your governor, what a gift. We're hoping she might come speak at our conference. So we have our partners in New York State and our certified hospitals. We have 25 certified hospitals, 2 bronze, 4 silver, 19 gold. That's the highest that you can get, reaching over 42,000 births statewide. And if we've distributed through just that program, 1,000 safe sleep spaces, which is different than the partnership that we have with your state with nearly 20,000 crivettes and 2,000 mini crivettes. And I see this slide is missing the number of partners and the number of building block grant recipients. I believe we're in the area of 84 partners across the state and 2 of our building block grant recipients. We did a grant for the first time in your state. We gave a grant to a food bank in Queens. So is that a safe place for people who are seeking support to go and get them? Because if they need food, chances are good they need a safe sleep space. So, and you guys are doing an unbelievable job. I was on the Turnpike in New York. My husband and I are walking through the rest stop, and up on the screen comes a safe sleep public service announcement. A mom and a mother and her mother talking about infant safe sleep. We're in the rest stop. My husband's like, "Hey, look at that!" And I'm like, "Telling you, it's New York. They're doing an unbelievable job." So now we're going to get to what we have to offer to you to support the work that you're doing. Again, everything that I'm going to share with you is free. It is accessible online. We are here to talk about ways that we might be able to change that, to update it or make it appropriate for some particular challenge that you're all facing, because we will say, don't remake the wheel. We've got the wheels here. If you need to put some cool rims on it, let us know. We will help with that as well. So everything that I'm going to share with you, one, it aligns with the American Academy of Pediatrics Safe Sleep recommendations. It is accessible, easy to use, and it answers the why of infant safe sleep. Why are we doing this? To prevent suffocation and SIDS. We took the AAP's recommendations when their latest version, right? They do it every 5 years. So I don't even remember the year now, 2018? No. In any case, I don't even know what this year is now, so let's not kid ourselves. So we took that information that the AAP came out with, and we we put it into 12 steps to follow for 12 months. That's how long you need to follow infant safe sleep. Not like the car seat where you're practically putting your child in the booster as they go to take their learner's permit test. But this year, you worked so hard to get your baby there. Let's do this safe sleep for 1 year. So we took those, we put them into this digestible format. You can see there's a simple infographic. And if you look at the language, it is do this, not a finger wag, don't do that. It is a do this that goes with the message. So our cornerstone of our free resource for safe sleep education is our Safe Sleep Ambassador. It has been around for a long time. We had 3,000 people complete it last month. It has incredible breadth of the people that it reaches because it is good for everybody to take. It's got a foundational knowledge of infant safe sleep. We talk about safe sleep and SUID versus SIDS like I just talked about. We talk about how important that baby's airway is and everything you're doing needs to be sure that's not compromised. And we go through those 12 steps. It is online. It is self-guided. Should take about 20 minutes to do it. There's 60 slides written at an 8th grade reading level. You do a post-test and you get a certificate that you see up here. That is great if, for example, you need one of your clients or patients to complete it for to receive a pack and play or a cribette. It is great if you're using it for onboarding as well. And there's a QR code there, but you can go right to cribsforkids.org, click on our education menu, and everything is listed there. The other, our newest actually, for this general education, because we have newer stuff with the professional training that I'll talk about, is our safe or not safe photo quiz. We found that people would be looking at our, they would have taken our Safe Sleep Ambassador and then they'd send a question like, hey, is this safe? And we're like, no, that's not safe. Oh my gosh. So we designed a photo module, which is a series of 26 photos that shows actual sleeping, and it includes nuanced scenarios, baby sleeping in a car seat, sleeping in an alert adult arm, some cultural difference in safe sleep. And it talks about what's safe or not safe. Anyone can use this. You can use it individually to kind of assess where your knowledge is. You can use it maybe to evaluate after you've done some training or education, but you can also use it in a large group environment to generate conversation. If you're doing it on your own, it should take about 10 minutes. 26 photos. You don't get a certificate with completion. If you're doing it in a group, it can take as long as you want it to because there are lots of questions and it's super engaging. Again, there's that QR code, but it's under our education menu. Here's an example of what you might see. So here you see a photo and you click, is it safe or not safe? Following in the same vein of our do this rather than a no finger wag, when you click, it tells you what is good that's happening in that sleep space and what is bad, if there is something bad. So you might say, oh, mom is awake. Well, mom is clearly getting ready to go to sleep, right? So when you look at this, you would say it's unsafe. It's unsafe because you see a blanket there and you see a toy there, and those are risks of suffocation. Super simple, but it tells you what is good too. They're on their back, they're in their own space, and the crib mattress is just covered with that tight fitting sheet, and there's a pacifier, which is good to keep that airway open. We also have a video library, again, free. You can access it on our YouTube channel, or you can access it through our Safe Sleep Ambassador. Again, quick digestible videos for those audio-visual learners. We have one for our 12 steps for safe sleep. We have video on why back sleeping and aspiration is not a danger and why you do need to keep baby on their back, the dangers of rebreathing if baby's on their tummy. There's a little agency you may have heard of, Charlie's Kids, who did these great videos that are meant for sharing. And they offer co-branding on that. We knew to take advantage of that, so that's out there. I hope that your agency will do the same. And we also just released a series of 4 videos for our higher risk or most vulnerable babies, and those are out there for free as well. Spanish and English, under 4 minutes long. Those Charlie Kids videos are perfect for sharing. They're about 15 seconds more. Step in if I'm wrong. They are available on our Safe Sleep Academy, which is designed for parents, designed for those who are caregivers, those who are caring for infants. It's a one-stop shop for safe sleep guidance and resource. There's FAQs, links to our ambassador and video, where to find a crib, and more. It's got the more in-depth information about each of our 12 steps, and it's how to make safe sleep sustainable, how and when to ask for help, setting realistic expectations about baby's sleep, tips for soothing a fussy infant. So again, targeted to families and caregivers. It is online, it is mobile friendly, you can click through it, and it's that big F word, it's free. So this tells you what that 12 steps looks like. So it's the infographic, and then you click on that and it'll take you to more information about each of those 12 steps. That's what you'll find on the Academy. Then our newest one, how am I doing on time? I'm doing all right, is our professional training series. Spencer joined our agency about a year ago after we had worked with her for 2 years on another, on the module that launched all of this. This builds on the general information in the Safe Sleep Ambassador and is targeted and developed for particular professions who are working with families and infants. So it gives them practical strategies, scenarios that they will encounter. These modules that you see listed here, child welfare module, the home visiting module, our child care module, and our first responders, which was just released 2 weeks ago, a week and a half ago, last week. And then coming in April is a nursing module, and coming in July is the doula model, doulas module. Just like our ambassador, it is online, it is self-guided. It's a little longer, right? It's 80 slides on average. You can take all of these if you choose. You can take some of them if you choose, but they, again, are there and for free. And I want to be sure I don't get ahead of myself. Hold on, let me see if I wrote something down that I should be saying here. 1 second. Okay. So each of these modules too has a tools that accompany that, again, targeted for the professional that's doing that. So for example, what you're seeing here is the home visitor self-assessment tool. So that's for our home visitors and for the child welfare workers who are in the homes. So this assessment tool was designed, it gives them structure to that home visit. It facilitates that safe sleep discussion. It makes sure that there's a consistent message about safe sleep. It prompts further open-ended conversation. It reflects the training content that the home visitor may have just gone through in that professional training module. And it also gives resources and referrals provided. The other thing that these professional training modules do for the very first time is it gives guidance on how to have that conversation when families are unable to follow infant safe sleep. How do you have that nuanced conversation? It will never be part of a public health message. But how do you have that one-on-one conversation to support families and make what isn't safe as safe as possible? That is what you'll find in that professional training series modules. That's a first for us. The way that you can, everything that I just mentioned, you can access no problem. You can also download these to use them as you like. We also have materials available for co-branding. Our 12 steps that you saw, for example, we have that in a poster and a flyer and a door hanger, badges that can all be ordered or downloaded and you can print locally. We have a video. We have a gallery of safe sleep images that you can use when you're creating social media posts or if you're doing your own marketing. Those, again, are all free there. You access that by becoming a partner. You get a passcode and then you get in to get everything. You don't have to purchase anything to become a partner, but we do hope that you'll consider that. So we invite you to stay connected with us. If you scan this QR code, you'll get a free Safe Sleep Resource Digest that includes all of this. That is the way that you will learn about our next super fun thing that we're doing that is brand new, which is April 16th, which is Wear Your PJs to Work Day. And we hope that you will do that. Even if you're virtually working, you can still, maybe you're wearing your PJs already right now. Maybe some people are. So maybe it's that day for you all the time. But this is one of the things that we offer too is our Safe Sleep Champions webinar. Actually, the Hankies will be joining us, or Charlie's Kids will be joining us next month, along with we have Danny Moran, who will be joining us, who's a wonderful mom, who also has a big presence on social media and is a product expert. So we're going to be giving on April, when you're wearing your PJs, you want to be trying to get to sleep. So we're going to be giving some real nuts and bolts information on how to support moms and those who are caring for babies. And then you also hope that you will join us, sign up for that Safe Sleep Champions webinar, Wear Your PJs. It's also a way to do some fundraising. I don't know if anybody here worked in the 20th century like I did, when we would have Wear Your Jeans to Work Day, where you'd pay like $1 or $5 to wear jeans to work. So we're hoping maybe some folks will use that as a fundraiser for infant safe sleep. And there's a whole kit out there. When you go to our website, cribsforkids.org, and click on the events menu, you'll see a link to everything that you need for PJ Day. That is it for me. Thank you so much. I don't know if we do questions now or all at once at the end.
Thank you so much. That was a wonderful presentation, Devin. Would anyone like to ask any questions of Devin now? We can also take some at the end. Kara, go ahead.
The presentation was excellent. I was thinking you have a conference coming up, but there's also, do you have in that conference ways that we can learn how to put together a pack and play?
Oh,
I learned about that when we went to the Prevent Child Abuse conference in Oregon, where there's an organization, I think in Kansas or something, that teaches you how to put the pack and play together and certifies you and all of that other stuff. And I was wondering if you had something like that, that perhaps was at the conference or something.
Kara, it's like you're a plant in the audience for me. Why, yes, we do. So two things there. One, we have on our video library that I mentioned are I think there might actually be 3 videos on how to assemble and disassemble a Cribette pack and play. It includes the clip-in bassinet feature that we have. So that is out there on our video library. I believe it is English, Spanish, and Haitian Creole that's available. Again, free out there in that video library. But you mentioned the certification. It sounds like you went to the Kansas Kids.
I would like to go. It's just that it's too expensive.
Right. So we're hoping that Kansas Kids, we're actively talking with them now, that they will come and do their certification as a pre-conference event here in Pittsburgh. So a way to get folks who can't make it all the way to Kansas, but who are in the eastern part here and might just be driving to Pittsburgh or so, can come and do that. So I will actually let the folks at Kansas know that we had somebody ask about that. So that's a good thing. So thank you.
You're welcome. And when is the conference again?
September 29th to October 2nd. It'll be beautiful. The city's going to look great because we have the NFL draft here in April. So they're gussying it all up. So it'll look great. Anything else, or we can hang to the end and Maura can go do her thing?
Sure. Let's go ahead and have, if we don't have any other questions right now, we'll have Maura present, and then we'll open it up for more questions from everybody. Thank you.
Hi, yeah, thanks for having me. And Devin, thanks for talking. I love Crips for Kids. I love all the materials they have, and I hope all of you are able to take advantage of all of the opportunities and free stuff and things that they have out there. So let me see if I can figure out how to share my screen.
So go to window or Chrome.
Don't be a show off and get it right away.
Oh, I'm not. Yep, I got it. Here we go. Maybe. All right. Did that work? Can you see it?
Yes.
Great. Okay. I am Maura Hankey. I'm here from Charlie's Kids. Bigger than that, I am Charlie's mom. So I'm going to talk about him and our mission, and also our newest material. So happy to be here. Go. So the mission of Charlie's Kids is to advocate for safe sleep to prevent infant death. I'm having trouble. How do I get this?
Back to tab right there.
Yeah. Oh,
Oh,
nope, that didn't work.
hold please.
Hold on. Sorry. Why is it?
I don't know how to move. If you close it, what happens?
I'll just move it up somewhere.
There it goes.
Okay.
Slide it up. Okay.
All right. Is that working again?
Yes.
Okay. Thanks. Sorry. Okay. So our mission is to advocate for safe sleep to prevent infant death. And here is our story.
In the United States, more than 3,000 kids die every year from a sleep-related death. And what that means is that about every 3 hours, we lose a child to this cause. The vast majority of these are preventable. And in 3 hours, we will lose someone. And 3 hours after that, we will lose someone. And 3 hours after that. This continues all year, every year. We collectively as a community have the power to stop that. And it starts with sharing the message of safe sleep.
So when Maura and I found out that we were pregnant with Charlie, we were over the moon. As first-time parents, I mean, so many of you guys know, right? Just the anticipation and the excitement of being able to bring life into this world and we really celebrated like all the milestones in pregnancy and just couldn't wait for Charlie to come.
I was a kindergarten teacher. Sam was a cardiologist. We really felt like the two of us were going to have this under control and be really good at it.
When Charlie was 3 weeks old, he was a little bit fussy one night, and my wife Maura was pretty tired, and so I offered to hold him so she could get some much needed sleep. I was able to hold him and get him off to sleep, and I sat down on the couch to watch Sports Center, and I had him on my chest while I was watching TV, and I nodded off to sleep.
True case of SIDS is a child is put down to sleep and there's no risk factors associated with that. So that child is alone on their back and in a crib, and that child passes away for a truly unknown reason. That does happen, and it's extremely rare. What happens much more frequently is a child is put down to sleep with a known risk factor.
And it could be prevented by following the safe sleep practices, which is putting your baby to sleep on their back in their own separate sleep surface with nothing around them.
Parents needed to learn about safe sleep in a new way. When we were taught about safe sleep in the hospital, we were given a brochure that we never read. I'm not even sure it made it home. So we wrote a board book. It's called Sleep Baby Safe and Snug.
It gives a new family, a new parent, a book that they can share and read with their child, but it also is a way for them to remember how to make sure that their baby's in a safe space when they're sleeping.
Taking what are the evidence-based recommendations that come from our scientific communities and distilling them down into materials that are really understandable for families.
There's also videos that Charlie's Kids Foundation has created, and these videos are very relatable. It's like talking to a friend. It's a quick video saying, like, we know that safe sleep is hard, and we know babies don't sleep through the night, but we also know that they will, and we're here for you.
I think that means that it is unquestionable that there are kids who are alive today who would not otherwise be alive without Charlie's gift to them.
He's still affecting families and lives around the world and making sure that the same thing doesn't happen to them as it did to us.
I just think it's amazing how one person can impact that many people.
My hope is that when people hear our story, that they practice safe sleep with their own infant, that they remember our story when they're exhausted so that they can muster up the energy to put their baby to sleep safely.
One infant loss due to preventable death is one too many.
We need people like you to come along with us and help us make a difference.
Please visit charlieskids.org to find out all the different ways you can support our mission. That video for me doesn't get easier to watch, but it's why I'm here. Today I want to talk to you about kind of the gap in the safe sleep messaging and how we used human-centered design to tackle that, embedding empathy and compassion into the safe sleep message. So Devin did a great job hitting on the SUID rates. This is the graph that shows at the bottom, you can see all the different categories that a coroner might put these deaths into. So accidental suffocation, unknown, sudden infant death. The top line at the blue is all of those combined. We saw a big decrease in those in the mid 90s with the Back to Sleep campaign. But since then, the graph has kind of just stayed where it is. And if anything, we're seeing an increase now. So these stagnant rates are calling for a different approach. The other thing that we know is that these babies aren't dying because they're following safe sleep practices. In 99% of these deaths, there is some sort of risk factor present. So that means that 99% of these deaths are preventable. We also heard from Dr. Rachel Moon recently that parents know the ABCs of safe sleep. They've heard the message, but they're just not practicing that. And there are a lot of reasons for that. This is a really hard thing to do. So this graph kind of shows that gap between the knowledge of parents and then them being able to put it into practice. So that's really where we're seeing a big a big gap and where these deaths are happening. So the problem is not that they don't have the information. The problem is that they're not implementing it. Psychologist Jonathan Haidt has this story where he talks about the metaphor between an elephant and a rider. So if we think about the rider, and up there you see mom with baby as kind of the rational, conscious part of our brain that analyzes and plans and can think logically. And then the elephant represents our emotions. So those are the things that kind of provide our energy for the action. And so while it appears that the rider might be in charge, if they, if they're going against each other, the elephant is ultimately going to win. So logic alone isn't going to create the behavior change. We need to engage and motivate that elephant or our emotions into that action. So using kind of that background, we partnered with a company in Cincinnati called the Live Well Collaborative, and they use human-centered design to create solutions for problems like this. So what does that mean? They observe and analyze this data. They learn from stakeholders. In our case, that was moms, and that was our partners who work with Charlie's Kids to distribute these materials. And they look to prioritize feedback over just like assuming what needs to happen next. So with Charlie's Kids, Live Well went out and interviewed moms, and they interviewed our partners, and they looked at current resources, not just from Charlie's Kids, but from all over that were available to moms and what was being used and how they were being talked to. And then they worked with moms to create a new brochure. What was so interesting about this is that we were really surprised about what we heard from moms. So we expected them to want to be talked to gently and to be supported, but instead they wanted to feel confident and empowered. We thought we would need to reinforce the rules. What are the ABCs? But instead they wanted actionable advice that they aren't getting from other places. We thought we needed to motivate them with statistics and the deaths behind this problem, but instead they just wanted acknowledgement that being a new mom is really hard. So how can a brochure solve this problem? What we heard from moms is that they wanted something interactive. They wanted to be able to write on the pages. They wanted realistic tips, and they wanted it to feel customizable to them, to be able to share it with others, to be able to talk about what their baby needed. And they really wanted to feel empowered. So at Charlie's Kids, we feel like we do talk to the rider often. We have our do's and don'ts list. We have our book, and we feel like those things are very logical. This is what you need to do. This is how a baby needs to sleep. But we're really proud of this new booklet because we feel like it really does address the emotions in the elephant. So this is our new brochure, except for we're not calling it that. We're calling it a booklet. So it doesn't look like a brochure, and that was intentional. We wanted moms to feel like this was personable, and instead of being an informative headline, we wanted to immediately invite them in. So right away, mom gets to write her name on here. She gets to include baby's name on here, and it automatically belongs to her. It's a pact between her and baby. The booklet is square. It actually fits right inside of our Sleep Baby book, which is super great when you're handing out materials to mom. She can have both. It's actually done in a matte color instead of a glossy brochure. And I love this picture at the beginning because we heard from moms that they just wanted to know that like there was a light on. And so I think the designer really captured that at the start of this page, is that right away we see the bright light. We see that mom's awake in the middle of the night, but hopefully she feels not so alone in that middle of the night. First things first, let's prioritize. So when baby is up in the middle of the night, what does baby actually need? Baby needs to be fed, baby needs to be burped, baby needs to be changed. And getting moms to know that this is something that's going to happen often at the beginning. It's going to happen at 1 a.m. and at 2:30 a.m. and at 3:45 a.m. And just kind of normalizing that infant sleep for them, that baby's tummy is tiny and they're going to need to eat often. And that's when people are asking, is baby sleeping through the night? That's not a normal question to be asking mom, because baby shouldn't be sleeping through the night. So kind of normalizing that these sleepless nights are normal, and just giving mom the next right step to do. What's the next right step to take? On here, you'll see a QR code that takes us to our video library that Devin introduced for you. And I love that because those videos speak both to the rider and the elephant. There's a big series of them. They're available in both English and Spanish. I'm going to show you one right now that kind of speaks to the elephant and just reminds mom that the stage isn't forever.
Your baby is going to cry. So will you. Your baby is not going to sleep through the night at first. Neither will you. It will feel really hard, and it is. But remember, your baby will sleep through the night eventually, and so will you.
So really quick video to kind of, just normalize that for mom, that she's not alone. And there's several in there. I think my favorite is set an alarm while you're breastfeeding. Just a reminder that you may fall asleep, but if you set an alarm, you're gonna wake up to that and be able to get baby in a safe spot. So there's a lot of good ones out there. Those are free on our website, and easy to share. This next page, teach me how to sleep. So babies don't come out with a manual, and they don't come out knowing how to do all of the things, especially how to sleep. And it's not something that we're really teaching moms either, is how to get baby to sleep quickly and efficiently so that mom can get to sleep quickly and efficiently. So here are some tips: swaddle them, sway them, do that shushing noise. And even teaching mom to put baby down a little bit awake, a little bit drowsy, so that baby can learn how to self-soothe and how to get themselves back to sleep. I think if any of you have ever put a baby in a crib asleep, you kind of like know that feeling of like trying to tiptoe back out of the room and making sure baby doesn't startle when they're put in the crib. So helping mom know that it's okay to put baby down a bit drowsy so that they can learn how to soothe together. We also have some bookmarks in here. So this first bookmark is actually for mom to share. So it's a reminder to grandma, to daycare, to babysitter, how baby sleeps, and something that mom can leave out and give away. And on the other side of that bookmark, we did the 1, 2, 3s of safe sleep. So you heard me reference the ABCs earlier in this conversation, and it's what most people reference. When we created those videos, we created them with these fierce group of women out of Cincinnati, from a place called Queens Village, and they were really offended by the word alone. And I think if any of you have ever talked to moms about safe infant sleep, that's a word that can feel kind of scary. And these moms were telling us our baby can't be alone because there's gunshots in our neighborhood, and they just felt like alone was scary. And so we changed the ABCs on our things to the 1, 2, 3s. So at Charlie's Kids, we say, place baby to sleep on their back in a crib and pack and play with nothing but baby. So the other side of this bookmark is a reminder for grandma or the neighbor how to put baby to sleep. And then we've got kind of the do's and don'ts here, but in such a gentle, loving way. So mom saying to baby, I love you enough to do this. Like, I love you enough to sleep near you, but not with you. So there's the co-sleeping message. I love you enough to know that a clear crib is best. And then moms wanted a place to write their own thing, to customize that. And so there's a couple of spaces there where they can customize that story. The QR code on this page takes you directly to Charlie's story that you guys just saw at the beginning of the presentation. We didn't want to put that message right in parents' face that this is real and this happens, but we wanted them to be able to access it. It's an important part of why we do these things. So they can scan that to hear our story. This is the other side. I'm strong enough to. I love this page so much. So reminding mom that in those deep moments that she is strong, she is a superhero, but that sometimes being strong means asking for help and not being okay. So reminding her to make a plan for those times when she's exhausted, to acknowledge that this is hard. And I think that's something, I think as moms, when we want to be strong, we think that we have to be the superhero for everyone and do all of the things. But we kind of want to recreate that message for mom and let her know that sometimes being strong is taking care of yourself first. The bookmark on this page is a reminder that this is just the beginning of the love story, that there are so many more memories to make and grow, and giving mom something to look forward to. And then on the flip side of that bookmark is a message from mom to baby, like, I love you enough because, or I will keep you safe because I love you so much. We'll see that in just a minute. This QR code here, sometimes we need to hear from other people that it's okay to not be okay. And so we created some mom to mom pep talk videos. So when they have the light on in the middle of the night and they feel alone, they can scan this page and hear from other moms that this is hard, but they're not alone. So I'm going to share a couple of those with you. These are also free and available on our website.
Okay, moms, if someone hasn't told you already, I will. It's okay to ask for help. It's okay to ask someone to take a shift so you can take a nap. It's okay to let someone rock your baby while you take a shower. And it's okay to ask other moms for advice. And it's okay to take help when someone you trust offers. It's okay to take care of your baby and yourself. You're a rock star, but you can't do it alone, and you shouldn't have to.
I love these two as a way to just text to new moms, just as a reminder, like, you've got this and you're not alone. Here's one more.
As you go through it, you learn and it gets better. Like, you realize, oh, I learned that this works for me in this way, or he seems to respond better to this. And I think just as much as it is a learning curve for me, it's been a learning curve for like my husband and for significant others. You know, he doesn't know what I need unless I tell him, or I express that. So I was getting really frustrated for a long time, expecting that he knew what I needed, or that why wasn't he doing X, Y, and Z, but he's never been a new mom. He's never been a dad, you know, and I think that's a real thing. Like, you have to ask for help or people don't know what you need, you know?
And this is the layout of those two pages too. I love you enough to, and I'm strong enough to, and I love the way that this folds out to remind mom that how much she loves baby and how strong she is. And the message that we just heard in that video is kind of echoed in this next space. It does really take a village to raise a baby. And this is giving mom permission to ask for that help and making her write down, like, who can I call? Who will show up for me so I can take a nap, so I can take a shower, so I can wash my face. It just gives her a second to think about that, because people do want to help when there's a baby and they don't always know what to do. But I think when mom has to make a plan and she has to write that down, sometimes that text or that phone call can be a little easier. Also reminding her she needs to eat. I'm going to keep this healthy snack on my nightstand because I need to take care of me too. So I love this message about Mom's Village. This was actually the most asked for page from the moms. They wanted to know that it was okay to take care of themselves. And we wanted them to know that when they take care of themselves, they're probably better equipped to take care of baby. So it's okay to change your shirt. It's okay to play a loud music and dance around the room. And then giving mom, we gave baby, these are the 1, 2, 3s you need to follow, but giving mom a reset too. So the 3, 2, 1, like, take that deep breath. So 3 deep breaths, drink some water, and tell yourself you're doing a great job. I actually have this in sticker format right on my laptop because I feel like I need to hear it, and I'm not a new mom anymore, but I do feel like it's just such a great reminder for all of us to just remember to like take a minute for ourselves and know that we're doing a good job, and to practice that self-care so that we can better take care of the people around us. And this is the closing page. This is the plan. This is what we want them to practice. And this is also customizable. It's a letter from baby to mom, which I love so much. Mom gets to sign baby's name at the bottom and decide, like, what does my baby like best? My baby likes to be rocked, or where does my baby sleep? So she kind of gets to circle that and really feel like this is the plan. We make plans for a lot of things. I planned what I'm eating for dinner tonight because I love food. But these moms need to make this plan. This is the most important thing that they can do for their infant at the beginning, is to make this safe sleep plan and to make sure people know it and to share it and to practice it. These are not available on our website yet, but these are little decals that are removable. Mom said they wanted a reminder on their mirror when they look in the mirror, just that they were doing a great job, that they needed to take care of themselves, that baby needs to be in a safe spot. So we may or may not have these up and running soon. We'll see. So things I want you guys to think about. How do you envision these materials working in your job? What do you think the moms in your community need to hear the most? How do you message to that elephant? And does this content give you hope, and why? How do you see that working? And just to close out, these are things that are all available. Charlie's story, you can always use that. You can always say, I met Charlie's mom and this is why we do this. This is why it's important. Our book is available at a very discounted price for you to share with mom. We want everyone to have access. Our digital videos and our mom pep talks are available for free. And then the other big thing that we're doing is that these booklets are actually available right now for free. So if you haven't ordered any yet, you can get your first 200 free on our website today. So you just sign up and go through all the stuff, and it'll tell you, right, that
Yep. Add it to your cart and it'll say $20, but I'll deduct the $20 before we
you
ship
will
it
not.
out.
Yep, you won't get invoiced for the $20. So go ahead and order your first 200 for free and see how you can use those. And then you guys are our biggest advocates out there for safe sleep, and we're so grateful. New York State's doing such a great job, as Devin said, and we're just really grateful that we have you guys out there showing up for mom every day and celebrating the small wins with her and helping her make her plan. So thanks.
Thank you so much for that wonderful presentation. It was really touching. My son loves the Sleep Baby Safe and Snug book. Does anyone have any questions for Moira, or comments, or any responses to her discussion questions? How will these resources help you? Do you find this story inspiring? Have you encountered difficulties getting moms to and helping moms to practice safe sleep? Oh, Kara, go ahead.
I thank you so much for the presentation. My heart goes out to you. Honestly, it really goes out to you. So I was thinking about, we're definitely gonna get the 200 books, definitely so. I had reached out to a gentleman before about even ordering the Sleep Baby Sleep books, because we've had them at my other agency and I wanted to bring them down here. And I know that sometimes you all have a grant or a scholarship or something like that. So we didn't get it the last time. I'm gonna apply for it.
You seriously are the audience.
You are
plant.
the audience plant. That's fantastic.
So actually, our grant is open right now. It opened February 1st. It'll be open to the end of February. You guys can apply today. I do encourage you to put as much detail about the work that you do. We get hundreds of grants that come through. So the more that you can appeal to us and the more information you can have about your program and how you're working with moms, it's really helpful as we're reviewing them. And you can even mention in the grant that you were on this call. That's always helpful too. So yes, the books are available right now on the grant program. We do get hundreds of applications, but I encourage you to fill it out and to give us thorough information about your program, and definitely order the booklets. And thank you for your kind words. I really appreciate that.
But I think it's really good. The reason why I had applied the first time is because I really like the book, and it's small enough that parents can have it. It's hard enough that kids can, the babies as they grow, they can hold it and all of that. And now that you've also made this the same size as the book, I think it's great because they, just like you said, they insert. So I'm super excited. I am going to apply again. This is Kara Stanley. I am going to apply again. And
thank you. You've got 2 grant reviewers here sitting right here. So thank you. I did see a note in the chat about dads. So this actually was specifically designed for moms. It was one of the things that came up in the conversations with moms, is that they typically are the primary caregiver. They typically are the ones that feel the most pressure and the most work. And dads and partners are a huge part of making this all work. So while this booklet is designed for mom and baby, we thoroughly hope that mom is sharing this not just with dad and partner, but with all of the people that are in her village and taking care of baby. It's a good check for dad too, to say like, oh, how can I show up for you? Like, oh, did you get to brush your teeth today? Like, maybe I can hold baby so you can go do that. Also, Spanish is coming. We are working on it right now. It's only available in English, but we are finalizing Spanish. We just haven't gotten it the translation quite right yet. So they have not gone to print, but they will soon.
I want to jump in. I'm Betsy. The reason we are even here today is because Holly was nice enough to share my information. I spoke with her at PrevCon, and she shared my information with the bigger group to invite us. So I know that Holly has the booklets, and hopefully she's using them. So if you want to know how they work in real time and how they're being accepted or reviewed or whatever the word is, out there with moms, hopefully she can help you out. I just threw her under the bus. So yeah. And then by all means, put it, you can go on to our website and order the packet of 200 for free, and I'll get those out to you next week.
They should also come with an instructor guide too, that will help you just like go over what we talked about today. Like, how do you talk to mom about this, and how can you help her create this customized plan so that she feels supported.
Thank you so much for sharing your personal experience with us. It was really wonderful to hear. I mean, it's very touching. I'm so sorry.
I have another question.
Oh yes, Kara, go ahead.
Those that are utilizing the book, do they do it in one setting, one sitting with the mom, or is it done in 2 or over time, just so it could seep in and be able to be reinforced? I'm not sure how they're using it, so maybe you can speak to that a little bit.
Sure. We have partners in all 50 states, and I would say that there's all different ways that people are using them. But I would say the gold standard is that you're having multiple interactions with mom, that you are meeting her on more than one level with this information, because especially when you're pregnant, when you've just had a baby, there's a lot of information you're taking in. And you know, as Devin was sharing in the graph earlier, this really is the number one thing that moms need to know in those first few months before they're moving on to baby gates, and, you know, what baby food they're going to feed their child first. This really is the number one thing. So the more that you can have those conversations and the more that you can personalize it to mom, the better.
Ali, go ahead.
So we've started using the both things from Cribs for Kids, the resources that she shared, and the Charlie's Kids information and booklet, and along with some resources that we received for the Safe Sleep with the sleep sack from the state. And we try to do it at one of the very first visits, whether it's our welcome family visit or when they're enrolling, because we have that requirement through Healthy Families to get that, the safe sleep information in right off. And it's really helped us, guide that. And we're making sure that we know, that we've shared the resource, and they're very visually appealing. They're great with the QR codes because everything has QR codes now, and people can sit and watch it. And so you're not having to bring something out and show it to them right then. You're letting them know, like, oh, this is something as you're using it. But it is a great resource, and it was, it's a great help for our Healthy Families programs, of course, because we know we don't have a ton of money to spend on things. So to have something that is so well done, and like somebody said earlier about recreating the wheel, right? So it's there. It's great for us to have as a resource, and it meets our objectives.
So Holly, because we use the ABC of Safe Sleeps, and we do that, our FRSs, or the Family Resource Specialist, Agnes is actually here. I'm not sure if Kebra's here as well. But sometimes they'll do it in the assessment part to make sure we get it in, as well as our FSSs will also do it, of course, when they're meeting with the moms as a regular home visit. Right, but because that book is so interactive, not like the ABCs of Safe Sleep, that can be done very quickly or within, a shorter period of time. This book is very interactive, which I love. That's why I was asking, do you do the book in one sitting for a whole home visit, or what's better to break it out,
We're dual role. So the person is going to be staying with them so they can refer back to it. And it depends, I guess. We try to present it at the welcome family visit. We do our visits that way, that we go out and we introduce our program first to make sure that they really want to enroll. And then when we do our frog, we may talk about it there. Depends on how much we were able to get into it the first time. We kind of show it as an example. These are some of the great things that we're going to be bringing out through our course, but then you're making sure, and like if it's a very early prenatal, we may wait so that we can talk about other stuff, because we want them to have the safe sleep area before the baby's here, right? And if they have to get connected with resources to get the pack and play or whatever, that they have that chance. And then, of course, if the baby's already here and the baby's been here a couple weeks, we want to make sure at that very first meeting, what does the sleep situation look like here? And, these are some resources so that we can, I guess, go a little quicker to make sure that they're safe from the start, I guess, if that's what you're asking.
That's helpful, Holly, because it sounds like you break up the book into different visits or keep adding to it as you go, and depending on what stage you're in. Okay, which makes sense. It will add to what we're already doing with Safe Sleep, based on what you've shared. So that's great. So thank you.
Thank you both so much. Does anyone else have a question or a comment? Anything? I see a lot of nice comments in the chat. Okay, well, we're a few minutes past 3 now, so I guess if no one has any further comments, we'll close. Thank you so much, all of you, for Charlie's Kids and Cribs for Kids, for coming to this to present about your organizations and your stories today.
Thank you for the good work you guys are doing.
Yes, thank you for having us, and thank you guys for being the boots on the ground.
Exactly. And our emails are in the invitation. So if you need to get a hold of us, feel free to email us. Thanks, Holly, for putting us in touch with this group. This was great.
Yeah, I really appreciate that, Holly. And okay, well, thank you, everyone.
Thanks.
Bye-bye.
Thank
Bye.
you.